Hey everybody, Dr. Schaefer here again. I am just going to give a quick tutorial on how to do cervical polyp and removal and specimen collection in the GYN setting. So this is usually a very straightforward small procedure. Sometimes though these come up in the midst of a routine pelvic exam and PAP because cervical polyps can be little small fleshy growths that happen at the cervical opening. Sometimes they're big enough that they've become irritated during sex or something so that the patient's complaining about some irregular spotting, and it turns out that that's actually not from the uterus, it's from this polyp. So getting that removed is a nice thing. Sometimes we also, in the all of us here at HCHC, in terms of doing physical assessments, sometimes have a patient who would like a skin tag or something removed. And so that can also happen in the GYN setting, even if it's not below the belt. So this is got some commonalities to other procedures. You're first of all going to want to get the patient to sign a consent form for the procedure. If we're doing a skin tag removal, this is pretty similar to probably what happens in family medicine. You're gonna, as the nurse, you're gonna want to get the provider usually 1 to 3 cc's of lidocaine local and something to swab the skin, like some betadine or Hibiclens. And then you're usually just going to use either a small scalpel or even a scissor with a little pickup to collect whatever you take off the body in terms of skin tags and place it in a labeled specimen container. Excuse me, with our Sharpie here. Because anytime we take something off the body, we want to send it to pathology. Okay, so that's really pretty straightforward for skin tags. A cervical polyp's a little different, but in some ways very similar. We're still going to provide the pathologist with the polyp once we remove it. And once we see it, usually after the speculum has been placed during a pelvic exam, what we're going to want to do is use a ring forceps, sterile ring forceps. And this is going to be, it's got a nice long length to be able to get at the polyp. And this is going to be handed to the provider by the nurse, and the provider is then going to reach in and try to grasp that polyp, lock it, probably with a rotating motion, remove it from the cervix, and then that is going to want to be deposited in the cup, which you have already removed the lid for, and the specimen is deposited in there. The patient might have a little bit of bleeding after the procedure, so a couple of things you're going to want to do is, number one, provide them with a pad. Number two, you might need to give the patient some expectations about cramping or a little bit of bleeding. It's also possible that the provider will not be able to get the polyp off. If the polyp turns out to be much larger or more involved, we might need to refer that patient out. But if we can remove it easily and quickly here in the clinic, that's a nice thing to be able to do for people. And again, you're just going to want to send the specimen and then help the patient back up afterwards. Okay, hope that helps.